Okay, so for the lower back, because I'm trying to keep this as accessible as possible, I'm doing everything from a chair. For some things, you might want a second chair nearby. So just having it kind of accessible. It doesn't need to be right in front of you just yet. So to start, I'm sitting kind of forward on my chair. I've got my feet maybe a bit more than hip width apart. And again, we're just going to revisit that pelvic tilt here. So spilling the soup bowl forward, coming back to center, spilling the soup bowl backwards. Okay, so just playing with that and noticing what your legs do. So there's a little bit of shift in my legs when I do this. But I don't want it to be like a really big thing. We're just pretty subtle. We're trying to really isolate that pelvis, spinning around the top of the leg bone, the thigh bone, and the low back's going to do a little bit of arching and flexing along with it. Okay? So now what we're going to do is we're going to let our feet come wide. Okay, so they're going to be quite wide. And this might be one where you want the chair across from you, but try it out without first. What I'm going to do is I'm going to start coming forward. I'm going to let my hands come between my legs. I'm bending with a fairly flat back for as long as I can, and then eventually I'm just going to let myself hang. My head's hanging heavy. I'm not holding tension through my neck. And it's hard to talk there, so I'm going to sit up, but you can stay there. You're really wanting to feel your breath fill that back body, feel that rounding and opening through the back of your spine, through the back of your rib cage, that lengthening along the spine, through the head. If that's too much, have the other chair a little closer in front of you, and you can come into kind of a seated child's pose, and you can have your arms kind of crossed and rest your forehead on your fists or wrists or forearms. And see if you can let all the tension go through your hips, your back, your shoulders, your neck, and just breathe. So you can walk your hands back up, you can come back up to sit. And so from here, we are going to definitely bring the chair in. We are going to use the backrest here a little bit. We're going to kind of lean back, we're going to get comfortable, we're going to have our feet on the chair. Now, ideally, you're on carpet. I'm not, so hopefully my chair's not going to slide away from me. But we're on carpet, we're leaning back if we can, as comfortably as we can. Feet are on the other chair in front of you. You can have one leg straight for now if you want. The bent leg, you're going to pull the toes back. This is just going to make your knee a little more, and ankle a little more stable, so that you can really focus on the movement coming from the hip joint. We're going to let that knee fall out to the side and come back in. And you can give it some support with your hands if you want. It's going to come in a little bit across body, but not a lot. The bum is staying pretty firmly planted on the seat. And you're just noticing if you can move just from that thigh bone, like right in here. So it might be really small. It could feel nice to have your hands there so that it doesn't feel like gravity's going to take the leg. And we're just mobilizing that hip joint for rotation. It is surprising. Well, it's becoming less surprising to me because I see it so often, but it's surprising for people when they realize just how little hip rotation they actually have, and they had no clue. And when they start to get it freed up again, so much stuff feels better, particularly their lower back. The hip joints and the pelvis and the lower back are very closely related. switch legs, so you can let this leg straighten out, bend the other, pull the toes back, and repeat that process. The hips and pelvis and lower back are all very interconnected, and if the hips are really stiff or they're not moving in their 6 different directions very well, then the lower back will start to pick up the slack and lend movement to the hip joints to do hip jobs. And your lower back is not your hip. So the lower back starts to get kind of pissy. And it's tricky because people want lower back pain relief. They want to stretch their back, they want to massage their back, they want to put heat on their back, when really that's just going to give them some temporary relief. And if they got their hips moving a little better, they might just find that a lot of things start to clear up on their own. Hip movement isn't the only thing that can impact lower back pain, but it can be a major contender, so it's always worth exploring first. Okay, so now that we've done some rotation on that leg, we're going to let both legs stretch out. And again, I'm still kind of lounging back here. I'm going to do a little bit of hip and knee flexion. So I'm going to let this foot slide towards me on the seat. So my hip is flexing. Now it's extending. Flexing. Extending. And just notice if you use your abdomen to pull the thigh in, or if you can just kind of generate it from the hip flexors. So maybe at first, the movement's down here. Try the other side. You can have your hands like right around the very top of your thigh to feel that area, because sometimes putting your hands on an area makes your brain find it easier to talk to the muscles. Okay. Now we're going to combine the two things we just did. I'm just going to bring my chair a little closer to me here. So we're going to come back to the first leg. We're going to slide that heel towards you on the chair in just flexion. We're going to let that knee fall out to the side a little bit. We're going to slide that heel back away while the knee is still kind of flopped out. And then once the leg's mostly straight, we're going to bring that thigh back to neutral. Slide the heel in. Let the knee drop out a little bit, not too much. Slide the foot away. And rotate the thigh back to neutral. So just do like 2 more of that. Okay, and then we're going to try the other side. So slide the heel towards you. Let the leg flop out a little bit. Send the heel away. Once the knee is almost straight, rotate the hip back to neutral. You can't really see my leg right now, but that's okay. Heel slides on the seat towards you, hip flexion. Bit of rotation, a little bit of rotation. Support it with your hand if you want, letting the knee flop out. Send the foot back towards the seat back of the chair. And let the thigh rotate back to neutral. So do a couple more of those. Making sure that you're breathing. Okay, one more. So we're going to come back up to sit here for a moment. We're going to revisit that first forward fold we did. So you can still use the chair if you want. Okay, walk your hands back up. Okay, we're going to come to standing. We're going to keep our feet wide. We're going to stand up. We're going to put our hands on this front seat. So now we're in kind of like a wide-footed tabletop position. So this is sort of like being on your hands and knees on the floor, except you're not on your knees and it's a little less weight on your hands, and we happen to have our feet wide. We're going to let one knee bend so that we kind of side lunge to one side just a little bit. It doesn't have to be a lot. We're going to come back through center and we're going to doing like a side lunge to the other side. And just notice what happens to your back. Are you able to keep your back fairly neutral, or as you move your legs and hips, do you do things with your back? So if you can keep it really shallow, if that's what you need to do to keep your back uninvolved and just going along for the ride, then keep it really small and shallow. Okay, we're going to come back through to just neutral. And now what we're going to do is we're going to send our spine and bum back, my chair a little bit more, back and forward. So when you come forward, there will be a little more weight in your hands. When you come back, there will be more weight in your feet. And if you look at me on the screen, my spine is staying pretty straight. The movement is coming from my shoulder joints. All right, so it's flexing and extending. And it's coming from my hip joints, flexing and extending. So you may at first just be doing teeny, tiny rocking motions. And if feet wide is uncomfortable, you can do this feet hip width apart. But this is again where a mirror is really handy because you can check. Because sometimes our bodies play tricks with us and it feels like we're moving from one area, or it feels like something isn't moving, but then when you can see it with your own eyeballs and go, oh, wait a second, that is happening, and then you can practice the movement while watching, it becomes easier to get the brain talking to the right places. And a really important thing to keep in mind is that when, you can come out of that if you need to, when you are suddenly aware that something was moving that didn't need to, and you're trying to do the movement, do the stretch without that unneeded body part moving, you're not wanting to achieve that by just locking it down and bracing. Because now you're teaching your body that in order to do whatever that movement was, but it requires a lot of bracing through that body part. And introducing rigidity into our life, we don't really need that. So you still want to be breathing, you want to be supple. That's why we just make the movement smaller within a range where that body part doesn't automatically try to help, okay? So I think for one more hip movement, what we might actually do is just a back of the leg stretch. So there's a couple ways we can do this. You can just be 1 foot at a time on the seat, and if you have a strap, you can put the strap around the ball of the foot. You can sit tall in your chair. You've got the strap on in either hand, and you're going to let that foot push away gently. You do not have to get to a straight knee. You do not need to pull back with the strap on your foot. It's just a gentle stretch. Even if you don't feel a stretch, you are still lengthening the muscle, and so you are still technically stretching. My computer screen is going to sleep. I should have plugged it in. Okay. Now what we can also do here while we're in this position is we can keep a little bit of resistance with the hands just so that the strap doesn't go slack. And we can just start to push the ball of that foot away from us, just really gently. It doesn't need to be really hard. It does not need to create a lot of sensation. And you're gonna hold that for a few seconds, make sure you're breathing, and then you're slowly going to release that push. And if you want, you can give just a little bit of a pull with that strap. And then we're going to give a little bit of a push. Breathe. Slowly let go. And just a teeny tiny pull back, not much. Okay, we're going to switch legs. So get that around the ball of your foot. Slide the heel away from you. It doesn't matter if one leg was able to straighten more than the other. Each leg's going to go at its own pace. That's fine. So just a super gentle pull, just enough that the strap isn't slack. Sitting nice and tall. Make sure that you're breathing. And then you can gently push that ball of the foot into the strap. Breathe. Let that go real nice and slow. Nothing shocking. Tiny amount of pullback. Gentle push again. Slowly let it go. Tiny amount of pullback. And then just let the strap go lax. You can throw it away from you. You can bring your foot down. Just going to quickly revisit those pelvic tilts at the beginning. See if anything, we didn't do anything too specifically drastic with the lower back, aside from the back responding to pelvic tilts and letting it hopefully relax when we were in that child's pose. We mostly worked with the hips and the back line of the leg and some rotation. But like I said, the hips can really impact the lower back. So maybe you notice something different in the back from working on the hips. Maybe you don't today, that's fine. Sometimes those things don't change right away. Okay, let's revisit that twist we've done a couple times now. So one hand reaches to the opposite knee. I just had a couple little clicks in my spine that felt nice. Other knee. And again, with this, we're not pushing off of the thigh with the hand. We're not generating the twist from our arms. The arms are just guiding us in a direction, and we're using our obliques. We're driving that twist through the middle body. If you want, you can revisit that twisting with the arm movement that we did in the last video. So bringing the arm back, shoulder blade moves towards the spine, reach it all forward, twisting away, arm stretches out away from you, blade moves away from the spine, bring it back. Okay, switch sides. So reach the elbow back, twist back, twisting forward, arm reaches away across body, blade moving away from spine, bring it back. Okay. Alrighty. That's some little hip movement, bit of spine movement at the end. Hopefully that feels good, and I will see you next time.